We begin with breaking news. Just days before the start of a new school year, the Rochester City School District is in crisis mode, working to address a major transportation issue.
What happened, Dan, is that over the last couple of weeks, we've had a lot of resignations and retirements. About 50 to 70 of our bus drivers over the last 2 weeks are not there.
Good evening. I'm Doug Embledge in for Don tonight. An emergency meeting of the school board is now planned for tomorrow. This after changes were already made to start and dismissal times for city schools. And as Dan Track tells us now, schools are asking if families can arrange for transportation for their own kids for at least 6 weeks.
Doug, Rochester is not alone in this crisis, but just when the school district thought their issues have been resolved, one board member tells me there was a wave of resignations and retirements. Some of these school buses could still be sitting empty when the first bell rings in Rochester. At issue, a staffing shortage of epic proportions.
There is a transportation crisis in the state of New York and across other states because of COVID-19.
In a Facebook post Wednesday, Board of Education Commissioner Beatriz LeBron said early retirement has also played a major role.
And it's compiled this transportation issue into this massive snowball for us at this point.
Within the RCSD, roughly 28,000 students depend on district transportation through contractors. In early August, when it was realized there would not be enough time to hire and train new drivers, the district adjusted its start and dismissal times. But within the past 2 weeks, the situation has grown more dire, as dozens of drivers have either resigned or retired. Board Vice President Cynthia Elliott is proposing one possible solution in the interim.
One of the ways in which I believe we can help is that if we continue with the bus services for our younger students, say pre-K through 8, and then the 9th, 10th, 11th, 12th, that they do online learning.
In the meantime, schools are now asking parents like Sarah Abrams to step up if they can.
So the request from the school district is for parents to consider whether they could commit to transporting their child in the morning and picking up in the afternoon for 6 weeks.
All right, happening today, another local school district getting an early start to the new school year.
Sam Carter is live in Brockport this morning. And Sam, today seems like a good day to kind of just slowly ease the students back into the routine.
Just stretch out a little bit, Alexis. Just get accustomed to the day. And then maybe take a few days off after that. Maybe not. I don't know. It's day one here in Brockport, guys, and we are all getting jacked up for school going on because today all K through 12 students here in the Brockport Central School District will go back to school. Obviously, all of them will be wearing masks. That's a state mandate. But something Brockport's doing is every single student in the district is going to have to do a health screening. Now, younger kids, their parents are going to take care of that for them. But older kids, middle schoolers and high schools, they can go to a website that they can find through the Brockport Central School District site, and they can do their health screening there. Now, all of this is to keep students safe, but it's not just the students and teachers and everybody else in the district is going to have to do this. If you're going to enter a building in the Brockport School District, you are going to have to fill out one of those health screenings. So it's not just for students, it's for everyone. And again, if you're not a big fan of going back to school today and you're watching this, good news. You got tomorrow off and you got Monday off. 1 day of work and a 4-day weekend. We should all be so lucky.
Healthcare workers in New York have 25 days to get vaccinated as part of that state mandate. But a letter sent to the governor today by leaders in 10 rural counties around Rochester warns this mandate could actually lead to a severe shortage of healthcare workers. As 13 WAM's Tyler Brown tells us, the letter describes what they are calling a recipe for crisis in hospitals and nursing homes. Tyler?
Doug, the major concern here is that many workers will quit rather than get the vaccine. Already short-staffed hospitals and nursing homes would be left with even fewer employees as COVID cases rise and flu season begins. This letter addressed to Governor Kathy Hochul and the State Department of Health describes what county leaders say could be unintended consequences of the state's vaccine mandate for all nursing home and hospital workers.
We've had our nursing homes and our hospitals reach out to us and indicate that they have a significant portion of their staff who is unvaccinated and doesn't wish to become vaccinated.
10 rural county leaders fear a mass exodus of healthcare workers could force some hospitals and nursing homes to reduce their bed capacity by 1/3 or more.
And if we were to see an increase in COVID patients requiring hospitalizations or even flu or anything else coming into this winter, there would be no capacity within the system to address those acute care needs.
One example is Livingston County's Center for Nursing and Rehabilitation, where roughly 40% of staff is still unvaccinated.
The worst case scenario is you're having to kind of close off units and areas of a facility because you can no longer staff the operations due to the circumstances.
County leaders say while they do support the vaccine mandate, they are calling for more options to prevent the statewide healthcare worker shortage from being even worse.
Why don't we just have the people test out that aren't vaccinated on a more regular basis versus having the potential predicament of having mass staff exodus vis-a-vis resignations and retirements for those that don't want to get vaccinated across the entire healthcare system.
The only county in our area that was not on this letter is Monroe County. County Executive Bello said today he believes the situation in Monroe County doesn't warrant the same concerns.